Hello, good morning, and welcome to COVID-19 and food access, an ongoing crisis. My name is Cindy Vanden Bosch, and I am hosting this morning, and we'll be joined by a couple of guests. We'll be hearing from Lauren Margulis, who has overseen a grocery assistance program on the Lower East Side out of the Essex Market. And we'll also be spending some time today with Dr. Eliza Kinsey, who is an associate research scientist at Columbia University's Mailman School of Public Health Department of Epidemiology. And she'll be speaking with us about her research into the history of food access and sort of how we got here and what we can do to support improved food access for people who are facing issues of food insecurity, which now today in New York City accounts for about 2 million of the 8.5 million New Yorkers that live here, as well as, of course, in other parts across the country. So we really thank our guests for taking the time to share their stories and knowledge with us today. Before we speak with our guests, I'd just like to share a little bit of background about Turnstile Tours for those of you that are not familiar with the work we do. Turnstile Tours is a company that specializes in doing tours in partnership with different nonprofit organizations across New York City. And so in normal times, we bring people together to discuss stories and share stories that are underrepresented in the public record, and especially about the people and systems that make New York City work. As a result of the pandemic, we started doing virtual programs on March 19th. And this Wednesday, we will be doing our 100th virtual program. There's no way we would have been able to keep working and keep doing what we're doing if it hadn't been for those of you out there that are joining us day after day to learn stories that we might otherwise be sharing on tours. But in some cases, these virtual programs have given us opportunities like that of today to share stories that we might not have explored in the same way on our tours. So we are grateful for you joining us. Just a few housekeeping items. I know we have people watching from Facebook as well as watching from Zoom. If you are watching from Zoom, we encourage you to ask questions, share your comments, and you can do so by clicking the chat box. So please just click the chat box. There are two options. One is for all panelists, and the other is for all panelists and attendees. If you select all panelists, those messages are going to go to me, and they will also go to our producer, Doug Chapman, who's behind the scenes today. And he'll do his best to get those questions along to me to ask of our guests. So that's how we're gonna try to make the program interactive today. We wanna answer your questions that you do have the best we can. We also have a person behind the scenes, Stefan Dreisbach-Williams, who is live captioning the program. In order to access those captions in Zoom, you click closed caption and you can open the closed captions. If you are watching from Facebook and you would like to have closed captions, go to our website, register to join us via Zoom so that you can see closed captions in Zoom. You can still register, and that also opens up opportunities for you to ask questions and engage with our guests today. In the next couple of days, I want to mention some of the programs that we have coming up. Tomorrow, Brian Hoffman, who has been with us for over 10 years, leading food cart tours, he is going to bring on guest Matt Shapiro, who is a lawyer and an advocate at the Street Vendor Project. And they're going to do a retrospective on the Vendy Awards, looking at the history of this street food competition over the last 10 years or so. We're also then on Thursday going to do an exciting program where our staff member, Doug Chapman, will be bringing on Jean Marie Keevens, who has made puppets for shows like Sesame Street and The Muppet Show. And so we'll be learning about puppets and puppet making, which we're very, and Shadowbox puppets, which we're very excited about. This coming Saturday, we're going to go live to the Waterfront Museum, which is on a barge with David Sharps, who is the founder of this museum. So we have a lot of great programs coming up. And on Wednesday evening, in celebration of our 100th program, we'll be doing a trivia night that will be free. We welcome everyone to come. And it'll be sort of a retrospective as well on the last 100 days, with many trivia questions drawing from programs that we've had, that we've either led ourselves or that we've brought on guests for. So without further ado, I would like to welcome Lauren Margulis to the program. She's actually at the Essex Market right now. In her role there, she oversees community partnerships and engagement, and she's going to share with us an update on the grocery program that they've implemented in order to help people in the Lower East Side of Manhattan get groceries in a time where they might not otherwise afford to do so. Lauren, if we can bring you on. Thank you so much for joining us, Lauren. Could you share with us about this program that you started, and also the role that the Essex Market plays in general in providing food access for residents that live on the Lower East Side of Manhattan?
Absolutely. Hi, everyone. I'm Lauren Margolis, the Community Programming and Engagement Manager at Essex Market. Thank you so much to Turnstile Tours and Cindy and Andrew and everyone there for having us be a part of this really important conversation today. We typically serve folks through a program at Essex Market that we call Fresh Bites, and this is a free weekly cooking and nutrition program that is open to the public for anyone to attend. And when they do attend, they receive a coupon that they can use to redeem fresh fruits and vegetables sold at our grocers at Essex Market. So obviously when the shelter-in-place order came through, we ceased all programming and events at the market, and the folks that we used to work with really lost this important source of education and extra dollars. So we first utilized our programming budget to do a grocery drop-off with our partners at the Chinese American Planning Council. There's a housing for the elderly just right across the street from Essex Market, and we dropped off about 150 bags filled with a bunch of different types of fresh produce for those folks. What we had been hearing from people is that they had been receiving prepared meals, they had been receiving pantry staples, but really not a lot of fresh fruits and vegetables, which is really the backbone of our Fresh Bites program. So that was a really great experience, and we had a lot of positive feedback. So we started a fundraiser where we ended up raising just about over $8,000, which was well above our expectations, just from generous individuals in our community that wanted to help. And we called this fundraiser Fresh Food for Our Friends in Need. And so we've since partnered with the Grand Street Settlement to do another fresh food bag distribution to about 200 seniors in the neighborhood. And next we plan to work with the pantry that runs out of the Seward Park Extension building, which is also right across the street from Essex Market. They're serving thousands of people every week with pantry items, and we're just trying to do a small part by providing some fresh produce.
Thank you so much, Lauren. And in terms of your Fresh Bites program, at normal times you would be hosting weekly classes for local neighborhood residents. Could you tell us a little bit more about that program and how you're adapting during the pandemic?
Sure. So this program ran during the week in the morning hours, and so we really tended to attract a large senior population. The Lower East Side has one of the largest concentrations of older adults in all 5 boroughs. So this is a really important group for us to be serving. We've spent a lot of time over the last couple of weeks just focused on also supporting our small businesses with social distancing measures, getting them with online delivery that's available to anyone for both fresh and prepared food. So that's been our focus. But later this month, we are bringing the Fresh Bites program online, which is really exciting. We've learned a lot from Turnstile Tours and the great programming that they're doing. And so the last week of June, we'll be starting 2 classes, one focused on adults of all ages, and then one targeted more for kids. And again, this is free programming that people can participate in. And one of the other pillars of the Fresh Bites program is really about being able to prepare nutrition meals using fresh fruits and vegetables when you're on a budget. So all of our recipes are designed to be served for under $2 per portion. And again, the focus is really to help people increase their consumption of fresh fruits and vegetables and do so in a way that's on a budget.
At Essex Market, there are a lot of vendors that take SNAP benefits. Could you speak to that a little bit? And I know that's been the case for years, in part because the Essex Market is part of the public market system. So it's supported by the City of New York and it's nonprofit mission driven. But could you speak to that as well?
Absolutely. So all of the vendors that are eligible to accept EBT at our market do so. And many of our grocers report that they do upwards of 35 to 40% of their annual business through EBT, with the electronic benefits transfer system. So this just demonstrates that, you know, there's a great need in our community, and that Essex, really one of the reasons that, you know, we continue to exist is because of this need and being able to provide fresh food for our community.
And last but not least, the Essex Market itself is comprised of over 35 vendors that are all mom and pop family, mostly family owned businesses, many of which are operated by immigrants. So there's also when people come in and they spend money at these vendors, they're really supporting those families and their employees.
Yeah, absolutely. I mean, as a city-owned property, these vendors are paying below market rate. It means that our food is typically more affordable than some of the larger chain grocery stores in our neighborhood. And also, frankly, they just don't have a lot of space. And so they're going to the wholesale fruit and vegetable markets, fish markets, meat markets on an almost daily basis. And so another reason all of our customers, I think, really appreciate a place like Essex Market is because things are fresh while still being affordable.
Well, thank you so much, Lauren, for sharing that with us. We know you've been out at the market on a regular basis because it is providing essential services, and we want to thank you for launching the groceries initiative. Is there a way that people can support that now if they'd like to?
Yeah, definitely. You can visit our website, which is essexmarket.nyc. And in the navigation, you'll see a link to the Fresh Food for Our Friends program. And if you would still like to donate, every dollar is going to go towards those grocery bags for people in need in our community.
Thank you so much. We really appreciate you taking the time today, Lauren.
Thank you, Cindy.
Mm-hmm. So now we are going to bring on our second guest, Dr. Eliza Kinsey, who is going to be sharing her research about giving us some historical perspective on food access and on policies that affect food access, both in New York City as well as across the United States. And she's going to be sharing a presentation with us about her work and her research that she's done in other contexts. Eliza, she's also a good friend of mine and my husband, and we've known her for many years. Eliza, thank you so much for joining us today.
Thank you so much for having me, Cindy. I'm really excited to be here today.
Can you share a little bit with us about your research background and how you came to look at issues of food access?
Sure. So my background is a little bit of a hodgepodge in nutrition, urban planning, and public health. And so I've really been kind of focused at that nexus of built environment and health, and thinking about food access and health disparities within urban populations for a number of years. And I sort of came to that interest actually dating way back to when I met Andrew in high school, and we worked on an organic farm together. And so I've been interested in issues of food and healthy food for a number of years.
And Andrew is my husband. For anyone who isn't familiar, you might have seen him on some of the other virtual programs. So that's really interesting. And you're going to be sharing some of the work that you've been doing at Columbia. How long have you been at Columbia University? And I don't know whether this would be kind of, if you could give us just an overview of what you're going to be sharing with us today.
Sure. So I've been at Columbia in the Department of Epidemiology within the Mailman School of Public Health for the last 2 years. And today I'm going to be sharing a little bit of a sort of background on what food insecurity is and how we measure it here in the US, and a little bit of the history of different policy and charitable sector responses to food insecurity within the US, as well as some information about what's been going on with food insecurity during the pandemic and as a result of COVID. And I have been working specifically in the last few months and issues related to food insecurity that has developed during the pandemic or has been exacerbated during the pandemic. I've been doing a lot of work looking at policies within the SNAP program to respond to the food insecurity crisis, as well as within the National School Meals Program. And I'm going to talk a little bit about both of those.
Thank you so much. Will, if you'd like to kind of take it away and share your presentation, but as we go along, if there are questions that people have, please make sure to drop those into the chat box, and I will be sure to share those with Eliza, because this is such important information. It's important that everyone is able, to get sort of the questions they have answered, and so we'll do our best to do that today.
So Cindy, are you able to see my screen at this point?
Everything looks great. Yes.
Great. Okay. So I'll go ahead and get started. So as I mentioned, we'll start with a little bit of a background about what is food insecurity and how prevalent is it in the US today. And then I'll provide a brief history of some government and charitable sector responses to food insecurity within the US. We'll talk a little bit about the impact of COVID-19 on food insecurity, and lastly end with some current policy responses, as well as a few suggestions for actions that you all can take to get involved in helping with this crisis. So, excuse me, sorry, remembering how to advance the slides. So we'll start with what is food insecurity. So food insecurity is defined as at times during the year, people having uncertain or being uncertain of having or unable to acquire enough food to meet the needs of all household members because of insufficient money or other resources for food. Alternatively, food secure means that there is access by all people at all times to enough food for an active and healthy lifestyle. So being food secure includes, at a minimum, the ready availability of nutritionally adequate and safe foods, as well as an assured ability to acquire acceptable foods in socially acceptable ways. So that means without resorting to emergency food supplies, scavenging, stealing, or other coping strategies. And these are all come from the U.S. Department of Agriculture's definition of food insecurity, and USDA is the organization that oversees the measurement of food insecurity within the United States. So the food security measurement tool, which is developed by the USDA, classifies people into one of 4 food security levels or categories: high food security, marginal food security, low food security, which means that people have experienced challenges with food access, which they addressed with a variety of coping strategies like using emergency food resources or obtaining federal food assistance. But generally, these households did not have a disruption or an overall decrease in their food consumption during the year. And then very low food security, and in this instance, at least one member of the household had to reduce their food intake at some point during the year due to insufficient resources for obtaining food. So I think it's important to remember that food insecurity within the US exists within an economic context of both rising income inequality and dramatically increased income volatility. So between 1996 and 2011, the number of households living in deep poverty, which is defined by those as living on less than $2 a day in cash income, grew by as much as 130%. And the number of households for whom SNAP is their sole source of income has doubled since 1992. 19% of households in 2016 had zero gross income. And the family income instability has nearly doubled since 1973, as measured by either short or long-term drops in income. So currently in the US, and this is prior to the start of the COVID-19 pandemic, the US household food insecurity rate was 11.1%, and it was 14% among families with children. But as you can see from the graph on the right, food insecurity rates had actually been dropping in the US. So 11.1% may seem high, but it actually was much closer to 15% in the years immediately following the Great Recession. And we've been seeing this steady decline in food insecurity since then until we arrived in the current crisis. Within New York City, these numbers are even a little higher. So 14.4% of the city's population is food insecure, and those are based on 2016 estimates. So a little older than the national numbers that I provided to you before. Brooklyn is the borough with the highest food insecurity rate. More than 1 in 6 Brooklyn residents, or 18.2%, is food insecure. And then you can see the distribution by the other boroughs in the chart on the right.
Eliza, yeah, Eliza, when we talk, we have a question here. When we talk about food insecurity, could you share just sort of what does that mean for a family that might be food insecure, or how are we defining that?
Yeah. So when we think about food insecurity, we mean that the household had insufficient money or other resources to acquire food at some point in the last year. Typically, food insecurity is measured on an annual basis. You will see when I get into talking about the COVID measurements around food insecurity that we can do measurements on a shorter term basis as well. And so that means that a household is uncertain about where the money is going to come from to acquire their next meal, or uncertain whether or not they may have enough food to last for the week or the month. It doesn't necessarily mean that people are skipping meals or are going hungry, although it can mean that. But given those 4 categories, if people are in the low but not very low food secure category, they may just be struggling with having enough financial resources to acquire food, but not necessarily to the point where they're cutting the size of their meals or actually cutting meals.
Right. Thank you.
Yeah. Thank you for that question. So now I'm going to move into talking a little bit about the history of responses to food insecurity within the U.S. So the present day, much of the responses have been around federal policy related to food assistance, and I'm going to talk a lot about SNAP, or the food stamp program. The present day food stamp program, which is now known as SNAP, bears only moderate resemblance to its early roots. So it was first included as part of Roosevelt's poverty interventions, and this really marked the early foundations of the American welfare state. And New Deal era food relief was partially intended to stem the tide of poverty and food shortages happening in the wake of the Great Depression. However, the program was really designed more to supplement the crashing farm incomes due to a production surplus than as a mechanism to feed the poor. In 1939, President Roosevelt implemented a food stamp program on a trial basis. And the USDA, or the US Department of Agriculture, issued stamps of 2 colors that directed subsidized consumption to surplus agricultural items as declared by the Secretary of Agriculture. This is an example of some of those really early food stamps. They were actually a paper stamp or coupon.
And so, Eliza, before this point in time, if someone needed food assistance, what would they do?
So I will talk a little bit about that in a later slide, but prior to this time, there wasn't really a federal response to hunger or food insecurity. So people would have turned to the charitable sector. Likely to a church or an almshouse, a soup kitchen, that sort of establishment in order to get meals. So this early pilot of the food stamp program, where food assistance was tied to agricultural surplus, proved to be a sort of tenuous programmatic linkage, because when the war hit, the original food stamp program was terminated, and those commodity surpluses, those commodity agricultural products, were channeled into the Allied forces. And food assistance programs that were run by the government really didn't fully recover from those wartime setbacks until there was a renewed attention to poverty in the 1960s. So as a presidential candidate, JFK toured the rural South and was really astounded by a lot of the poverty that he found in parts of Appalachia. And a newly sparked attention to the persistence of poverty in the US at that time spurred development of a pilot food stamp program that was then followed by the passing of the 1964 Food Stamp Act, which was signed into law by Johnson, and this officially established the current food stamp program. So Congress amended the Food Stamp Act in 1971, and this established both uniform national eligibility standards and benefit levels in line with the USDA's requirements for a minimally adequate diet. This spurred rapid growth in the program, and by the early 1980s, expenditures on food stamps had increased 47-fold, and the program served 1 in 10 Americans. So the original authorizing legislation of that 1964 Food Stamp Act had the following stated goal: to promote the general welfare, that the nation's abundance of food should be utilized to safeguard the health and well-being of the nation's population and raise levels of nutrition among low-income households. So the new food stamp program was designed more to increase total food consumption rather than to direct consumption towards surpluses, as had been true in that original New Deal era program. But even in this new incarnation, food assistance remained under the authority of the US Department of Agriculture. And the passing of the food stamp bill and now the farm bill thus required significant compromise between urban liberals who were advocating for hunger relief and rural conservatives who were pushing an agenda of agricultural support. And that tension around the farm bill continues to this day and really echoes some of the early roots of food relief in this country. I'm seeing a bunch of questions pop up. Let's see if I can access them. Oh, sorry, Cindy, you're on mute.
Thank you. just a few comments, but otherwise I think we're okay.
Okay, thank you. Mm-hmm. All right, so then as part of the 2008 Farm Bill, Congress changed the name from the Food Stamp Program to the Supplemental Nutrition Assistance Program, also called SNAP, and that is the current name and how most people today probably are familiar with the program. This change in the name was made to emphasize the nutritional or healthy component of supplementing low-income shoppers' food budget. The new name was also more aligned with the modern system of electronic benefits transfer, so benefits being distributed on a card similar to a debit card as opposed to through a paper coupon. And this was implemented both for efficiency and to help reduce some of the stigma that was associated with the former paper food stamps. And this is an example of an EBT card from New York State from 2009. I think this is a sort of old example, but gives you a sense of what that card might look like. So food assistance as welfare. As welfare, or what we think of as traditional cash welfare in the US, has shrunk in recent decades, food assistance programs now serve as one of the largest components of our social safety net. 1 in 7 Americans receives benefits through SNAP, and in 2018, the federal budget for SNAP was $68 billion. So food assistance programs like SNAP and school meals may not be what people typically think of when they think of welfare, but total SNAP allocations in 2015 were more than 4 times the amount of block grant funding that was designated for more traditional cash welfare programs like TANF. So I think it's important to remember that our federal food assistance programs are both anti-hunger programs as well as they are poverty alleviation programs. SNAP is a federally funded and state-administered entitlement program, which means that its roles respond cyclically to fluctuations in the economy and particularly to changes in the unemployment rate. So it's important to remember that right now, the number of people who are receiving SNAP is going up and up and up as the unemployment rate increases. The average monthly SNAP benefit for a family of 4 is $448, and that equates to less than $1.25 per person per meal. So while these benefits are essential for low-income families, they're also still a pretty modest sum of money that people are receiving. So in addition to SNAP, the federal government administers a number of other nutrition assistance programs, including child nutrition programs and a lot of programs for seniors. Much of the expansion of food assistance came as a response to the widespread urban crisis in the 1960s, and this was true as well for the National School Lunch Program, which was expanded under Johnson's Great Society legislative agenda. This marked a real turning point in federal food assistance from a Depression-era sort of temporary relief measure to a longer-term welfare assistance and poverty program. As with SNAP, the National School Lunch Program and other school meals are an in-kind transfer, meaning that people are given money that is designated only for food, and is intended to alleviate hunger and food insecurity. And school meals specifically is really targeted at improving the nutritional quality of children's dietary intake. The National School Lunch Program, much like SNAP, was also originally designed as an outlet for agricultural commodities and to serve as a price control mechanism for surplus farm production. And while agricultural support is no longer the primary goal of the school meals program, the availability of agricultural commodities still plays a really large role in menu design today.
Eliza, one of the things that we've learned about in our research for the tours has been the fact that during World War II, for example, there was a realization that there were major issues with malnutrition in certain communities where men didn't necessarily qualify to serve due to issues of malnutrition and health. And that also played a role in informing some of these federal programs that were eventually put into place.
Absolutely, and I think we've seen that particularly play out in programs like the National School Meals Program, where there are really stringent regulations around all of the nutritional components that can be included in what is designated as a school lunch or a school breakfast. There's been a lot more political backlash around having there be nutritional recommendations or guidelines associated with SNAP.
Right, there's kind of that balance, right, between the surplus food that's available and the goal, which is really to provide nutritious food that nourishes children in this case and families. We are seeing in New York that, and I'm sure this is something you've been looking at, but schools have played a major role during the pandemic in helping to feed families during this time with pickup options.
Absolutely, and I'm going to talk a little bit about some of the innovations that school districts are using right now, including in New York, to get meals to children who otherwise would be getting those meals in school, but since school is out of session, they've been finding other ways to distribute those meals. Oh,
that's great. Thank you.
Yeah, thank you for raising that point. So as of 2019, the National School Lunch Program and School Breakfast Program served approximately 15 million breakfasts and 30 million lunches daily at low or no cost to low-income students. And nationally, K through 12, among all school-age children, the School Meals Program served more than 7 billion meals to students each year. So it's a huge meals program and poverty alleviation program within this country. And then lastly, I want to touch briefly on the charitable food sector. So societies have been providing free food to citizens in need for centuries. This is nothing new. But in the US, a key component of domestic food assistance and emergency food really started in the progressive era in the late 1800s and then sort of took off during the Great Depression. And that's when we really start to see the rise of things like bread lines and soup kitchens and food pantries. However, this really exploded in the 1980s due to economic recession, increasing poverty and government retrenchment of social welfare benefits. So food pantries and soup kitchens had existed before then, but we really saw this huge explosion post-1980. And the statistic I have here is that over 90% of food banks, about 80% of emergency kitchens, and all known food rescue organizations were established in the US after 1981. So this sector, the charitable food sector, has really changed dramatically in recent decades and has grown into a quite large nonprofit industry that serves millions of Americans each year. So, and we're gonna shift gears a little bit and talk now about what's been going on with food insecurity in the US as a result of the COVID-19 pandemic. So just a little reminder, prior to the start of the pandemic, the US household food insecurity rate was 11.1% and 14% among families with children. And these are based on 2018 estimates, which is the last year that we have national data for this measure. And as you would anticipate with rising unemployment, we would expect that food insecurity would be rising as well. So there have been a number of different surveys nationally that have been administered to try and measure what's going on with food insecurity in the US today. This table shows results from the Northwestern Institute for Policy Research, and they are using data from the COVID Impact Survey, which collects data on economic and health outcomes of nationally and regionally representative samples of American adults. And it's funded by the Data Foundation and conducted by NORC at the University of Chicago. And these data tables show results from the first wave of the COVID Impact Survey that was administered in late April. So as you can see from the orange line, food insecurity has been declining in the US in the last decade after the most recent peak immediately following the Great Recession. And 2018, with our last year of nationally available food insecurity data, we had that rate of 11.1%. So the yellow triangle shows what they predicted the food insecurity rate would be as a result of COVID unemployment numbers. And the blue dot shows what the actual food insecurity measurement was based on the COVID Impact Survey. And you can see that it's even higher than what they were able to predict based solely on unemployment data. So we're looking at a 22.8% food insecurity rate among all households. So more than double the rate that we had been at previously, which is astounding. And this number has grown even more among households with children, where we generally tend to see higher rates of food insecurity. So here we're seeing, based on these survey data, nationally, a household food insecurity rate among households with children of 34.5%. And again, these numbers are from the end of April. The numbers may be higher now, given that the pandemic has been going on for at least another month.
Wow, it's unbelievable, but it's understandable. I mean, we're seeing in a place like New York City, people now having 3 months of back rent. And so you're making a choice between food and rent and maybe can't yet go back to work. So, but it's astonishing to see these actual numbers and that it's more than a third of all families that are facing this concern.
Yeah, really astonishing and troubling. And as we have seen prior to the pandemic, food insecurity is a challenge that disproportionately impacts Black and Brown families, and that is true during the pandemic as well, particularly for households without children, where we're seeing that disparity is even more pronounced. So we're seeing in households with children, food insecurity rates among Hispanic or Latinx populations as high as 42%, and 38% within Black non-Hispanic families. So really troubling numbers. Also, while food insecurity is certainly disproportionately impacting lower income households, I think it's important to remember that during this pandemic, we're also seeing food insecurity rates within some of those higher income brackets as well. And this is really an issue that is touching lots and lots of households across the US right now. So I'll just point out that within that 75,000 to 100,000 income bracket, 28% of households with children reported food insecurity as a result of this COVID impact survey. So talk a little bit about some of the current policy responses to this food insecurity crisis during COVID. There have been a lot of different federal relief bills targeted at addressing hunger and food insecurity. A lot of those policy measures have been implemented through the SNAP program. This just outlines a few of the provisions that have been put forth or established through those earlier stimulus relief bills. The first is that SNAP, emergency allotments for SNAP have been increased such that all households are now eligible to receive the maximum benefit. I think it's important to remember, however, that while all households can now receive up to the maximum benefit, the actual cap, the maximum amount that households can receive has not been increased. And 40% of households on SNAP were already receiving the maximum benefit prior to the pandemic. So for those households, they are not able to receive more now than they were before the pandemic started. And this is an issue I'll touch on a little bit in the next slide as well. Another provision through some of those earlier stimulus bills was the Pandemic Electronic Benefits Transfer Program, also called PEBT or Pandemic EBT. And this makes it possible for households with children who would normally be receiving free or reduced price school meals to get those benefits, the dollar amount for those benefits added to an electronic benefits transfer card so that their households can use those dollars to purchase groceries for the household. There have also been a number of other policy provisions to make re-enrollment more flexible and reduce some of the work requirements and make it possible for people to stay on the program for a little bit longer than they otherwise would be. And then currently the HEROES Act, which has passed the House and is awaiting a vote in the Senate. This new bill would provide many provisions for SNAP, including $10 billion in additional funding that would actually increase the SNAP maximum benefit by 15% through September 2021. It would also increase the minimum monthly benefit, which currently is $16. So for households who are just barely over that eligibility threshold for SNAP, many households are only getting $16 a month currently, which obviously isn't going to make a big dent in your grocery bill if you are out of work or struggling with choosing between paying your rent and buying groceries. It also suspends time limits for SNAP. So that is the sort of the current status around SNAP policy that we're looking at is the HEROES Act, which we're waiting to find out when it will be voted on in the Senate.
And what are your thoughts on populations that are living in the United States that can't access these benefits? For example, undocumented immigrants, or maybe people that just have never used these benefits before. And do you have any thoughts on sort of, or has any of your research been related to those populations?
Yeah, so there are a lot of efforts to close the SNAP gap, or the meal gap as it's often referred to bring in households who haven't previously been enrolled in SNAP but are eligible. And I think that those are really essential tools, especially right now, in reaching households who maybe don't realize that they are eligible for benefits or are overwhelmed by the administrative hurdles of getting enrolled in the program. I think it's essential that those households that haven't previously been enrolled be connected with so that they can access these benefits. And as well as, I mean, my personal opinion is that the benefits should be available to undocumented populations as well. But I think that makes it especially essential that those populations have access to other sort of charitable sector relief efforts so that they can access meals as well. So there have also been a number of federal responses related to school meals. The Families First Coronavirus Act gave the USDA the authority to issue nationwide waivers to ensure access to school meals. And through that, the USDA granted 18 nationwide waivers between March 20th and May 1st. And this provided significant program flexibilities for states to determine where and how school meals could be served during school closures. Because as you know, schools across the country have been closed since starting in early March, and then definitely through today. So the waivers included allowing multiple meals to be served at one time, permitting a meal to be provided to a parent or guardian without a child present, relaxing nutrition requirements for federal financial reimbursement. And the intention of these waivers was really to ease program operations and protect the health of students and program staff. So to continue providing meals during the COVID-19 school closures, school districts have implemented a number of different innovations. They have switched to a grab-and-go format as opposed to the sort of congregate cafeteria-style setting that school meals are typically served in. Many districts have been trying to maximize program reach by situating their meal delivery in central community locations like parking lots or community centers or libraries, apartment complexes. Other districts have been delivering meals at intersections along bus routes, and home delivery has even been used in some rural districts, although the USDA currently is not providing reimbursement for delivery-related expenses. And then specifically in New York City, unfortunately, we don't yet have robust estimates of how many of the billions of school meals that would have been served during the past 3 months nationally were ultimately distributed, but districts across the country have really been working tirelessly to get meals to students throughout the pandemic, and New York City is no exception to that. The New York City Department of Education currently is providing 3 meals a day to children and adults at 435 school sites across all 5 boroughs. Between March 13th and April 13th, they reported serving more than 3 million meals to children. And just to provide some context, prior to the pandemic, they were serving more than 1 million breakfasts and lunches daily. So probably not yet reaching up to the number of meals that would be served if schools were in session, but really doing their best to get as many meals out there into the community during these school closures. So I just want to end with talking a little bit about what you can do to help if this is an issue that you feel passionately about and you'd like to get engaged and be involved. First, you can reach out to your senators and ask them to support the HEROES Act. And if you, like me, are strapped for time and appreciate a pre-written letter where you can fill in a form, the Center for Science and the Public Interest has a great pre-written statement that you can send to your senators about passing the HEROES Act. Secondly, you can stay up to date on advocacy alerts. The Food Research and Action Center has a really wonderful update center, as well as Center for Science and the Public Interest. You can volunteer. Lots and lots of community organizations, food banks, and food pantries are desperate for volunteers right now to help with food distribution. And there are a lot of ways that you can do that in a safe, socially distant way.
Yeah, yeah, I was just going to share that there are a bunch of mutual aid, neighborhood-based mutual aid organizations that have popped up during the pandemic, where it's neighbors helping neighbors, finding out what food those neighbors need and purchasing it for them. I know of elderly individuals that are living, let's say, on the 20th floor of their apartment building that just have not felt that it was safe to go out. And so their neighbors and these types of networks are going out and doing that shopping for them and sharing the list with other neighbors. And so it's been interesting to watch that sort of informal organization pop up, much like we saw with Occupy Sandy after Superstorm Sandy, when there were just so many needs across a place like New York City. And then of course, there's all these nonprofits as well as companies that we're seeing implement new systems and new measures, and even Congress members like Alexandria Ocasio-Cortez, her office in Queens partnered up and created a way for food vendors to make food to serve to their neighbors, to people in places like Jackson Heights and Queens. So but there are so many of these organizations across the entire city that are looking for volunteers or financial support if people don't feel safe or comfortable going out during the pandemic.
Absolutely. And I think it's been, for me, it's been really inspiring to see neighbors, you know, jumping in to help each other, as well as to see small local business owners thinking of innovative strategies that they can use, whether it's using their kitchen or using their restaurant as a distribution site to get food out to people who need it, and particularly to people who feel that it's unsafe to go out and get that food themselves.
Yeah, and I actually, we have a new question from the audience here, which is about those wealthier families that are facing food, maybe not wealthy as maybe not, but you know, people that have are in higher income brackets that are facing food insecurity right now. There's a question, is that because their income is reduced? We assume temporarily, or is it some other reason, or do we not know?
So I don't know based on the report, those data I was sharing from that report, but I think based on what we know about food insecurity, it is, people fluctuate in and out of a food insecure status. So people generally aren't, you know, either food insecure or not forever. And so I think it makes a lot of sense that people may have temporarily lost work or had their hours reduced, maybe their partner's hours were reduced, and so their financial situation has changed, even if only temporarily, and has resulted in some uncertainty about how they're going to acquire food.
Got it. Okay. Yeah. And then another question we have here, this is actually from Stefan, who's one of our staff members, and he taught in Northern Maine years ago. And he said, surrounded by broccoli and potato farms, but their school couldn't get local produce because the farms and school didn't use the same payment systems. His question is, are there fluctuations in food insecurity just a measure of poverty, or is it indicative of something more?
Are the fluctuations that we're seeing currently in terms of food insecurity just a fluctuation in poverty?
Yeah, or in general, is that sort of indicative, is that a measurement of what we're seeing in terms of poverty? Like, would you say that if a home is food insecure, that I guess the question is that a measure of poverty, or is it indicative of something beyond that?
I think that often it is a measure of poverty. I think we often think of food insecurity as sort of a proxy for poverty. However, you know, if you think about currently households who maybe have school-age children who are used to having their children receive at least 5, maybe 10 meals a week in school, they may not necessarily have seen a reduction in their income level, but they're seeing a big change in the sources of food that they are accessing for their families. So I think it's not necessarily going to be lockstep income and food insecurity, if that makes sense.
And then beyond volunteering, here I see voting and the census. Could you talk to us a little bit about how that's going to help us? I mean, it may seem obvious, but I think it's really important to underscore, and especially in this moment.
Sure. So voting, obviously, super important to get people into office, to get elected officials in who are going to help to support initiatives that are going to bolster our federal food assistance programs and get relief efforts out to low-income families who need help getting food. SNAP has forever been a very political issue, and so I think it's important, you know, ask your elected officials, ask people who are running for office what their stance is on things like the Farm Bill and food assistance programs, and find out how much they're going to go to bat for anti-hunger relief programs. And then the census is super essential in getting communities the resources that they need. So it's through the census that federal dollars are allocated to different municipalities and locations. And if we don't have an accurate read on populations, it's hard to get the financial resources out to those communities.
Wow, this was such an informative and helpful presentation. It's true, since the census, many neighborhoods in New York, especially neighborhoods with sizable immigrant populations or populations that are at lower socioeconomic levels, have in some cases lower documentation in the census, which then affects the benefits that people receive. So it's anything from allocations for schooling to support for people with disabilities to all these different things. So it's really important that people definitely, we had a program about the importance of the census and the history of the census. So if people want to go back, they can watch that. Is this the end of your slideshow presentation?
Yeah, this is the end. I can stop sharing my screen.
Okay, great. Yeah, I guess as you do that, one of the things that I wanted to ask you about, and this may not be a research focus for you right now, but just as an observer and also as a person who, and our company works with a lot of different companies and organizations that are connected to food systems in New York City. And we've seen an interesting reorganization out of need in the last couple of months, where businesses, for example, like Brooklyn Grange Rooftop Farm, they have 3 rooftop farms where they now have a partnership with Rethink, which is based out of the Brooklyn Navy Yard, but they're serving communities all over the city to make really good, healthy meals available to families. And this was work they were doing before, but it's markedly expanded. We've also seen other businesses like restaurants try to find creative ways where they can, if someone who can afford to pay for a meal, then they'll donate the other meal to a family in need. I'm just wondering, from your perspective, especially since you've done all this research about the history of food access, whether you think that some of these informal systems could help us in a systemic way moving forward, or whether we really need these policy changes in order to ensure that all people have access to food and get the support they need.
Thank you, Cindy. I think that's a really important question, and I think it's a both and. I absolutely think that these informal systems are important tools. You know, we've seen this before in the community garden movement, in the after Occupy Sandy. I think now we're seeing all of these mutual aid and sort of smaller scale ad hoc neighbors helping neighbors things pop up, and they are super important. But it's also really important that we get federal policy and support in place. Part of the reason that we've seen this massive rise in the charitable food sector, in food banking and food pantries, is because the federal government sort of stepped back, and to fill in that vacuum, this nonprofit industry stepped in, and not in any way to diminish the super important work that sector is doing. It's hugely important, the food that's being distributed through those charitable sectors, but some argue, and I would agree with this, that the more that the nonprofit sector steps in, the more room it gives the federal government to sort of step back and not have strong social safety net programs in place. And so I think it's really important that while we are providing this mutual aid and helping our neighbors, that we're also putting a lot of pressure on our elected officials to make sure that there are really strong supports in place to help low-income families.
Absolutely. And, you know, we want to live in a society where people don't necessarily fall through the cracks. And if it's a federal supported program, the hope would be that people could have food to get by on a daily basis. So we're really grateful for you taking the time to share your expertise and your research on this timely topic, and also to educate us about what we can do. So I know that there's a lot of new information I personally learned today, and I hope that's the case with folks who were watching. There is some feedback from one of our attendees, Howard, who wants to thank you and said that it was really an eye-opener for him, especially with the data as to the breadth of the hunger need right now. And so I think we'll end on that. Thank you so much, Howard, and everyone else for watching. And to both Dr. Eliza Kinsey for sharing her research, and to Lauren Margolis from Essex Market for sharing her experience of organizing the grocery program. Thanks so much, everyone. Oh, there's one more question. I'm sorry, I have one more question that Andrew just brought in from the other room. And it is, if you could design your ideal system for an imagined future, what would that look like?
My goodness, that's a big question to end on. But I think that a lot of other countries have been looking to food as a human right models, and I think that that is something that we haven't focused on much in this country. But ensuring food as a human right for all is something that is just a basic right that is required and everybody has access to, is something that we should really be moving towards.
Yeah, thank you. And you think about like food waste, if we could only kind of solve that problem, food that's going to waste in the supply chain in some way. So thank you. That is a vision that I think I'm actually on board with. I want to know that my neighbors and that everyone in this country can eat and support themselves as a basic human right. Thank you for your time today, Eliza. We miss you. Thank you for sharing your expertise, and thank you for the research, this important research that you're doing at Columbia University. For those of you out there watching Turnstile Tours virtual program for the first time, we have been at this now for almost 100 days. Wednesday will be our 100th episode, and we've been looking at all different kinds of things. In the case of today, obviously food access, but we've also interviewed artists, street vendors in their homes about their recipes and their businesses. We've been talking to manufacturers about that industry and sort of looking at how they're mobilizing during this time. So we've done our best to try to build community as a tour company that can't give tours right now. And we hope that this has been appreciated by those of you joining us from home. If you would like to support the work that we're doing, just today we launched a membership program. So for those of you that have watched us day after day for weeks or even months, we're going to be in touch with you, especially if you've paid for an all access pass within the last month or two. We will be in touch with you personally so that we can extend your access to our programs, because you've been such wonderful supporters. But we've put the membership program in place, which will be a monthly program as a way for people to provide support and help us keep doing what we're doing so that we as a business can weather the pandemic and hopefully continue to share this kind of important information and stories. And so tomorrow, if you'd like to join us, we are going to look at do a retrospective on the Vendy Awards, the Oscars of street food, which really lifts up the stories of street vendors in New York City, and has done so for the last more than 15 years. And on Wednesday, we're doing a free trivia night about many of the stories that we've shared through our programs. So we hope that you'll join us for that. And on Thursday, we'll be joined by a guest who's designed puppets and Muppets for shows like Sesame Street, and we're going to learn some puppet making skills ourselves. So we hope you'll join us then at 11 o'clock. All right, thanks so much. Have a good day, everyone.